optimal health is really a combination of a lot of different factors. It's effort put into a lot of different areas in our life. So again, I'm going to talk about these different areas, these different facets of health, and the different stressors that affect them, and then go over maybe some ideas on how can we manage some of these stressors, causing maybe physical stress. If we eat that diet that I was talking about before, too much sugar, too much refined foods, processed foods, that causes something called inflammation in our body. Inflammation, to give you an example, what is inflammation? If you get a splinter, it's an irritation into our skin, and what happens? It gets a little red, it gets a little swollen, it gets a little tender. That's a natural healing process that's trying to take place. It's trying to fend off or ward off bacteria and viruses. If it goes on too long, it causes tissue damage and tissue destruction. It becomes very bad. Well, certain foods that we eat or certain food choices cause us to become maybe a little bit more fat, a little bit more obese. We get more fat cells. It turns out that having a higher BMI or having a little bit more body mass index or a little bit more fat is correlated to or associated with producing more inflammation in our bodies. And inflammation is what causes pain. So they are finding people with a higher BMI tend to have more pain. They lose that weight, that pain goes away. So emotional stress, that's pretty much exactly what you think it is. That's the stress and the anxiety that we feel from day to day from having our job obligations, our family obligations, not taking enough time for ourselves. This can be depression. This can be, so when I was talking about the media, for me, just that overstimulation, I have recently become very interested in some Chinese health and healing. And they are big believers that emotions will affect our entire health status and can affect our internal organs. And one of the emotions that they have is something called joy. And I was talking to my wife about this. When you first read joy, what's wrong with joy? We could all be a little bit more happy. Well, joy, what they mean and what it translates to is just being overly stimulated or having an overabundance. Well, gosh, that sounds like our culture. We work so hard so that we can overstimulate ourselves, whether it be watching 3 hours of television per day, being on social media or some kind of Facebook or Twitter account for 2 hours. Meditation is a great way to kind of tune out some of the noise. It takes a lot of practice. Meditation is kind of like diet, if you will. You wouldn't expect to do a diet for a day or 2 days or 3 days and say, wow, I lost this weight, or wow, I feel great. It takes months before you really reap the rewards of that. And meditation is the same way. The idea of meditation, what it is that we live in words and we live in thoughts. And these thoughts and words are just always festering up and taking over our mind. And we never, and in these thoughts and in these words that we live in and in these dialogues, we're usually either way off in the future somewhere trying to plan for all of these things going on or some of these things that may happen some distant future away, this fantasy, or we live somewhere way in the past and replaying events that have already happened in our lives. And not often enough do we just sit and relax and be in the present moment where we are right now. And meditation is a useful way to bring us back to the present moment and to kind of let go of that internal dialogue that we all have in our minds. Health right now is something called the Biopsychosocial model of health. That's a very big word. Does anybody want to take a guess what that word means?
They all go together.
They all go together. The biopsychosocial model of health. Our biology, which is everything we're talking about. Our psychology, which is the mental stresses that I was talking about. And our social interactions, our social engagements. They turn out to be really important. So being here today, not only listening and getting information on health, it's healthy to be here and be socially active, socially engaged. It turns in crunches, and we have some personal trainers in here. There are some people with certain types of low back pain where crunches and sit-ups are probably the worst thing that they can do for their low back. They need other forms of strengthening their core. Other people can do crunches and sit-ups until the day they die, and they will never have a problem with doing crunches and sit-ups. They're straining all of the muscles in the back of their neck here, and they show me, well, I stretched my neck, I kind of modified it. You showed me one stretch, but it hurts back here, so I thought maybe I should stretch my neck down like that, and then I have to explain to them, no, those are the muscles that are already elongated, they're too long, they're lengthened, and that's causing them to be strained. So I have to show them, you're really tight through here, and I have to show them how they need to stretch these muscles, because these are the muscles that are pulling their neck forward. So they create muscular imbalances, and that's what's causing their neck pain. So I do that stretch for them, and I stretch their neck in through here. I show them exercises, how they can strengthen the neck muscles to keep their neck aligned and over their shoulders. Back there. So that goes above and beyond posture, and it's, well, how do we move now? If I bend over to pick something up, and I do that, well, that's that flexion again. I'm flexing in my low back too much. Now people are hurting their low back when they do that. That's horrible for our backs. So I need to teach them how they need to get their butts back a little bit more and keep their spine straight. So the personal trainers teach things like kettlebell swings or deadlifts, which are essentially just how you should bend over and pick things up properly, getting your butt way back and keeping your back straight. So everything's aligned as I do that. And that's how I can pick things up.